Okay, Jess, thank you so much. Well, great dental health. It's just so critical, as your mouth is it's the window of health to your overall body. And with advanced technology, dentists can now take images of teeth and check oral tissue without using those often uncomfortable bite impressions. You know all about it. I know all about it. Well, I recently had this procedure done at a great friend of the show, Dr. Marcy Guthrie's office. And Marcy's going to show us how this works. Marcy, good morning to you.
Good morning. Thank you for having me.
Dr. Guthrie, tell us, this changing technology that we have seen in doctors' offices and dentists' offices right now, this is a game changer, right?
Yes.
Tell us about this scan right here.
So this is Greg's teeth that we have here. He was a champ and came in, and we're looking at the viewing simulation right now that shows where all of his teeth are hitting.
Is this a good thing or not? This is like basically a report card.
It's good. He's got all of his teeth appear to be functioning together, and that's what we want. So it is efficient and fast, and it has helped open up the patient communication.
Yeah, and in terms of efficiency in the office as well, and the detail is striking to me. How down to a millimeter that you can see.
Micrometers, yes. So no more impressions, no more gagging, holding your mouth open for a long period of time. We can take breaks and the scanner can pick back up. We can pull it, take the scanner out and then recapture again as needed for patient comfort.
Dr. Guthrie, how is the technology helping you as a dentist?
Patients are really actually excited to have the scan done. They like seeing their teeth, and we can show them what we see in a way that we were never able to do before.
And how long have you had this?
I've had this since January.
So this is like the new baby
of the
office, right?
This is right.
When people have this done, I mean, do you have to prep them for this? I mean, what's the procedure?
We use this for several reasons. If we want to do a night guard, we quickly can scan. It takes less than about 5 to 7 minutes. We can do time-lapse features where that's even less. We can see where there's wear or recession. And also for Invisalign, we can capture images. We can track how the teeth have been tracking with Invisalign trays.
Dr. Guthrie, how long is a person in the chair?
For the scan?
For the scan.
Not more than 10 minutes.
10 minutes?
Yeah.
Can you at least show us how it was done?
Sure.
All right. What do we need to do right here?
Okay, I'm gonna put on some gloves because Greg's a pro at this now.
There we go.
He's had it a few times for crowns and bridges and implants.
And prior to, you had that gunk before, right? It was like almost like cement that they had to place in your mouth and let it sit for a while. It felt like a sidewalk here in the city of Richmond. But with this, not necessarily. You don't need any Novocaine. Is it painless?
It's painless.
All right, let's see what we got.
Yeah, okay, so this is just the handheld device. We just want to get the teeth as dry as we can. I'm left-handed, but
okay, does that work?
Try to.
All right.
Bring this around so we can see, and you're just going to open really big, and we're going to hit the button, and you can see it's going to start just capturing his teeth as we just go around. He's such a good patient. Just capturing the lower arch right now.
Now, is this just taking a picture, Dr. Guthrie?
It is, and it's not really showing there. So I'll try again. Gotta love computers. Here we go. Now, you've got his teeth showing in real time.
Oh, wow.
We got it. So just quickly, this is the beginning of his arch right now. It takes some more time to get all of the detail, but just to show quickly how it captures the images.
Dr. Guthrie, what are you seeing right here with the gum line and the teeth? Are there any observations that you can see?
So just pretty quickly, we can see that there's a little wear on your lower teeth just by the way the incisal edges of the front lower teeth look. And, recession-wise, it looks not too bad. I mean, this is just capturing a pretty quick glimpse for the segment to show, but it takes a little bit longer to capture the image that we showed prior to.
Now, Dr. Guthrie, with this stays on file, and I would imagine if I go back maybe in 6 months or to a year, can you do another scan?
Absolutely.
And will you see any differences?
Then we've got the time-lapse feature that can hone in and show us in fractions of a millimeter how much wear has happened, if the recession has gotten further, things that we measure in millimeters, but the micrometers that this machine allows us to capture just opens up a new world for us.
Micrometers, that's small.
Yes,
Let's move down here, Marce, because when I came in, we did this little scan. We were waiting for that, really putting the old technology of that mouth cement, really, and you send it away. But not so. You just sent some images away, and what do we have here?
So they have printed out a 3D model. These are Greg's teeth.
Wow.
And we were able to make a night guard off of these teeth. And they are pretty accurate to how he looks.
This is amazing. And from you, when you have this technology, when these show up, how exact is this?
It's as precise as we can get. With the old school impressions,
Oh,
this
look at this.
had to sit in the mouth for about 4.5 to 5 minutes. And if anything is off by a bubble or some discrepancy with the material or saliva, or the patient gags, we have to take it out, we have to take it over. So it becomes stressful not only for the clinician, but also for the patient.
You know, and I've got to say, Dr. Guthrie, I've had this done before, and it feels like you can't breathe. You're almost suffocating.
Right.
With that, not necessarily the case, takes a couple of minutes.
Exactly. We can take breaks and go back in, and the camera can start off right where we left.
All right, I got to ask, how much are you loving this technology?
I've been in dentistry for over 20 years, and this by far is my most fun piece of technology, not only for me, the patients, and my entire team.
Yeah, it's like a Lamborghini, isn't it?
It is.
Wonderful.
Yes.
Dr. Guthrie, thank you so much. It's wonderful to see you. And what would you give me a grade as teeth-wise?
A+.
A+, that's what I'm looking
Yeah.
for. I love it. Thanks so much, Dr.
Thank
Guthrie.
you.